SeniorLivingGuide.com podcast discusses topics which are relevant to the everyday lives of seniors and their caregivers. We are joined by experts who offer their advice and expertise on a variety of issues. SeniorLivingGuide.com podcast offers solutions and resources to create the best quality of life as we age. And now, let's welcome your host, Darlene Mahoney.
Thank you for joining us on another episode of SeniorLivingGuide.com podcast. If you enjoy this podcast, we have over 35 episodes that can be listened and downloaded most anywhere you enjoy music or podcasts, such as Spotify, Apple Podcasts, Google, and many more. Please don't keep our podcast all to yourself. Share with a senior or caregiver who you think will benefit from the support and resources that we provide. I am your host, Darlene Mahoney, and I'm super excited to share the news that SeniorLivingGuide.com provides a one-stop shop to finding senior housing solutions, including independent and active seniors a new home, while providing an excellent resource for assisted living, skilled nursing, memory care, or even home health and caregiving services solutions in one easy-to-navigate website. So please visit SeniorLivingGuide.com today. I would also like to thank our podcast sponsors, Parish Healthcare and Parish Medical Center. At Parish, they offer the Parish Senior Consultation Center and Parish Senior Solutions, where each patient's evaluation and follow-up care will be personalized to meet the needs of the individual and their families. I'm very excited today to introduce our guest. He is Joe Solsona, who is the National Association of Veterans and Families, which is a nonprofit organization helping veterans and their families. Joe comes from a long line of military veterans going back to the 1700s. Growing up, he was taught there were two things that you always respected, and it's your parents and the American flag that our veterans fight for. Joe started the National Association of Veterans and Families over 13 years ago after his experience with the VA, when he determined that the average person could not navigate the application process, and I can totally relate to this. Joe states helping veterans is not only about him, but about honoring our country's veterans and family members who have sacrificed so much that all of us Americans can enjoy our freedoms that we should appreciate. And I absolutely love all that. So welcome to the SeniorLivingGuide.com podcast, Joe.
Well, thank you, Darlene. It's an honor to be here and share the information with your listeners.
I'm super excited to really dig in. And I know you and I have talked quite a bit in the past. My experience is totally different than what you guys offer with your services. I've talked about my experience with my dad. My dad had dementia, and I had to jump in and take over and do a lot of things on his behalf. And one of them was he was a veteran and trying to apply for the services that you guys offer. But I didn't know about anything other than going straight to the VA. I can remember for days, I literally cried because it was one of the most stressful times in my life, is trying to get that application ready to go for him. I think it's important families and veterans know that there is a different process. Super excited to dig in and get more information from you. Tell us a little bit more about what the National Association of Veterans and Families specializes in. What is VA, pension, aid, and attendance? Because I know that that's something that you guys really specialize in.
Right. We specialize in this area. In the past, we did a lot of different types of claims. The expertise that we had really was helpful to make it simple for the veterans and family members. And the aid and attendance benefit gives the veterans and spouses age 65 and over the opportunity to receive the home and community-based services that they need in a consumer-directed way. Aid and attendance is for veterans, spouses, and widows who need assistance with the activities of daily living, such as bathing, getting dressed, and instrumental activities such as fixing meals and, going to the doctor, so forth and so on, or where they're isolated. and their caregivers are experiencing a burden like you experienced in the past. So veterans and spouses and widows in this program are given a dollar benefit for services that can be managed by the veteran or by one of their family members of the caregiver. Aid and attendance can be used to help veterans continue to live at home and in the community. That is so important.
Yeah. Well, my dad had moved into an assisted living based on the dementia diagnosis. He was not wealthy. So it was a matter of trying to find a way to budget based on his Social Security income and what he had in savings, which was not an exorbitant amount. My mom had cancer for 8 years, and it was a financial burden. She initially was diagnosed with cancer long before she qualified for Medicare. It really drained them financially. I was planning, not knowing how long he would live, making sure that he was in a good assisted living and knowing that the dementia care, those costs would continue to escalate based on his needs. I was going, okay, so I think he qualifies. Let me find out. So utilizing Google, going on, finding out that he did qualify, trying to figure out, what all that he needed so that I could budget and say, okay, so he's getting Social Security, and I can use X amount from his savings every month. And then this is what he'll continue to get. So that was really my do or die time with the VA. So that was my end goal for him, trying to figure out how to go about that and the frustration of it, the timeline and the suspected timeline. And it was digging through dirt, honestly. It's really nice to know that you can find alternate solutions and that those alternate solutions are out there. I'm excited to talk with you, a little bit further about what that aid and attendance means, how much you get and who qualifies for it. So we're going to dig in a little bit deeper into all of that for sure. So a little bit about who is eligible for aid and attendance.
In general, the VA looks at is that the veteran must have served during the wartime period. Usually the question that we get is, well, he didn't serve in combat or she didn't serve in combat. They really did not have to be in combat. They only had to serve during that wartime period and for 90 consecutive days and 1 day during that wartime. In addition to that, the applicant, whether it's the spouse or the widow, if you will, they need to be receiving care either at home or in a community. This is a reimbursement program. Basically, they got to be paying someone, and it can be a child, a third party that they're paying. The VA just doesn't give you the money. You have to basically be paying it out. It's probably one of the misconceptions that we get from a lot of the children is that, well, the VA is just going to give it to us because, dad or mom, served in the military. Not necessarily so. The other thing is that it has to be active duty in the military. So the reserves does not count as a wartime. Even they were in the reserves, they had to be active duty.
You mentioned something super important, which I didn't even really think about. I only applied for the VA benefits because my dad clearly needed it. Any healthy veteran that's just out and about can't just decide that he wants to get VA benefits. There has to be a physical need for it, is what you're saying.
That's correct.
Okay, that is a huge thing that I think some people may not actually realize. Another question I want to ask you, as far as wartime, what defines wartime? Does the Iraq war, is that considered a war, or is that, I feel like that was a long-term situation? Was Afghanistan, it's kind of hard at this point. I feel like we've had some, clearly Vietnam was a war, somewhere where you can go online and see what the government is defining as an actual war.
It's on the VA website, but the VA website, as you found out, is very complicated. I know the questions asked and what I want to find out sometimes, and it's a hard time for me. And we deal with this every day. Korean War, there's a defined timeline. The same thing with Vietnam. Now you're getting into the current conflicts, which is a war. Now that is a little bit different. It's not just 90 days active duty, but post 1988, they have to serve 2 years in the military. A little bit different now on the more current veterans. We are just now starting to run into the veterans that are in their 60s with dementia. Dementia is probably the most difficult thing that we're seeing right now. And that's my question. Why? are we seeing so much dementia? This is a question that we ask is, what's the life expectancy? It's a tough question to ask, but it's a question that needs to be asked because typically, we're dealing with the children and they need to face reality of what we're dealing with. So whether it's cardiovascular dementia, Lewy body dementia, or frontal lobal, that will determine the life expectancy, especially somebody in their 60s. Yesterday, we talked to a veteran, and when he was over in Afghanistan, he was taking all of these medications they were making him take. And then he came back to the States. They wouldn't let him take the medications. He had no idea what he was taking. And so we don't know if this is adding to the dementia, the number that we're seeing. We don't know, but it's heart-wrenching. But we want to make sure we help the veterans get not only the benefit, but that they're able to pay for the community or home care wherever they are till the time comes that they're not here anymore. It is important not to run out of money. That's why the VA benefit is so important, so important.
Absolutely agree with that. That's interesting. I had not heard that there was a rise in percentage of dementia with veterans. I know that in general, I think that there's an expectation that dementia and Alzheimer's is growing in percentages in general in the United States. So it would be really interesting to find out, some of it is considered to be hereditary, but I think there's got to be other issues at hand. So I would be really interested, and I know that they're definitely doing some research on that, but we've got to get some answers to this because it is just growing. I don't think anyone doesn't either have a family member or know someone very close to them that hasn't been diagnosed with dementia in the last several years.
And what's interesting, it's females as well as males. So it's spouses as well as the veteran. I just got a question at why? It's, suddenly we have this and we hadn't seen it before.
It's definitely growing and affecting our population significantly more now than I think that it has in the past. I think people don't want to talk about it because it's just scary. And they just are like, well, maybe if we don't talk about it, it doesn't happen to me. But it doesn't really work that way, does it?
No, it doesn't. And you have it in your family. And so that's reality for you.
Absolutely. And more of my friends are talking about their parents. And my dad was very young. My dad died at 72. He did not have dementia very long before it started affecting. He had frontal. He had issues with mobility. So he stopped being able to eat and swallow, and he had issues walking in his left hand. So he was actually a little bit more, he did not forget like people and things like that until like 4 days before he passed away. It affected his mobility, which is something I truthfully did not really realize until I got knee deep into the whole dementia thing, that I thought it was just your mind, but it really doesn't. It affects your ability to do all kinds of different things. So I think we're going to take a quick break and have a little word from our sponsors, Parish Healthcare.
At Parish Healthcare, we believe in our community. We believe in keeping our community safe. We believe in the art of healing. We believe in healing patients, healing families, healing communities. We believe in the best and brightest working together for the common good. At Parish Healthcare, our team focuses on you as an individual because every life is a work of art to us. Parish Healthcare, where the art of healing comes to life. Visit parishhealthcare.com/healthaware for a free health risk assessment.
At Parish Healthcare, we believe every life is poetry in motion, motivated by strength and determination. As your bone, muscle, and joint healthcare partners, we believe in blending the art of healing with the science of medicine to keep your body in motion. We believe in healing patients, healing families, and healing communities. For a free orthopedic health assessment, visit parishhealthcare.com/orthoaware. Parish Healthcare, where the art of healing comes to life.
Hey, Mom, how's the retirement home search coming?
Oh, my gosh. I'm just so stressed out. I don't even know where to begin.
Well, why are you so stressed? What's the matter?
I don't know where to find anything. I just need everything in like one place and know what all the options are.
Does the idea of searching for senior housing seem overwhelming and you just aren't sure where to even begin? SeniorLivingGuide.com has great news for you. We offer a one-stop solution to take the stress out of your senior housing search. At SeniorLivingGuide.com, both our statewide Florida edition book and website are created to make your senior housing search very easy for you to navigate. We provide details on communities, including retirement, assisted living, skilled nursing, memory care, and home health, allowing you to decide which best fits your needs and then connecting you directly with those communities. Visit us online at SeniorLivingGuide.com and start your search today.
I thank you everyone for joining us again. We're going to deep dive into how much does the VA pay, because that is super important. And I know everyone's probably thinking about that a little bit. So tell us, Joe, what that looks like, because I'm sure it also changes every year.
Well, currently the VA pays up to $24.30 per month. Okay, that's almost $29,000 a year, and that goes directly into the applicant's checking account. And it does go up every year at the same rate that Social Security increases. So if Social Security increases, like it was 5.8% this last year, the VA went up 5.8%. It's such an important benefit because it is tax-free and it's paid as long as the applicant is receiving care. Sometimes the only issues run into, they're in a community, they come home, they're not paying somebody, it will stop till they go back to the community. So as long as they're receiving care and they're paying someone, then the VA will, go ahead and pay the benefit. As part of the program, the veterans as caregivers do have, access, choice, and control over their long-term care services. So, for example, veterans can decide, what mix of services will be best, to meet their needs. And they can hire their own personal caregivers or aides, if you will, and it could be family members or their neighbors. So they could be in an independent living community and they have a caregiver, then they qualify for the benefit. In the past, you could not, but the rules have changed. So independent living, someone there, it could qualify as well. It is the difference, basically, for the applicant to be able to maintain where they're living versus, having to move to another community. It is very important. So over the last 13 years, we've done about 60,000 claims. I only know of 5 out of those that basically ran out of money and had to move and go on Medicaid. That's kind of a very, very low percentage. And that's how important that VA benefit is.
Yeah, and that's what we personally were trying to avoid, is doing any kind of Medicaid. So that was the biggest benefit of the VA. So I do have a question. So you say up to $24.30. So how do they make the decision on what you qualify for? What are those determining factors?
We always try to get the maximum, obviously the $24.30, and that is if your income is basically 5% less than what you're paying out. So, for example, if somebody they're paying out $4,000 a month for their caregiver services, whether it's in independent living or home care, whatever, okay, they can have up to $3,800 of income and still qualify for $24.30. But let's say their income is $4,000 and they're paying for the services $4,000. Well, they're over $200 more income than they qualify for. So instead of getting the $24.30, they're going to get $22.30, but they're still going to qualify. And this is where it gets confusing when you get on the VA website, is that basically it says you can only have $18,000 of income. It's net income after expenses. They don't explain that. Many times we'll have somebody calling us from Oregon or California, and they've been on the website researching, and they finally go to our website, and they're totally confused. We finally have to say, you got to stop going on the website. You got to listen to what we're telling you. That way we can give you the right information and get them qualified. But that's part of the issue that I had researching everything. Over 13 years ago, there was so much misinformation that was out there. And it's even worse now on the website because the rules changed on October the 18th, 2018. They instrumented some new rules and guidelines. So there's confusion going between pre-2018 and post. We do education seminars across the United States, not only for our seniors, but also for attorneys and other people that are giving out information. So they give out the right information. That's so important.
Right. And hence everything you just said is the reason why you end up crying for a week, because you can't figure out what the heck to put on there. And the fact that you would have to, I think, and maybe I'm wrong, and I think we had to put how much all of his costs were and had to actually break it down at the community he was living at, like what the cost of any kind of medication management, all of those things. We had to literally break that down for them. Is that correct?
That's correct. But there's a form that I know we send out where the community is, they are listing everything. So let's say they're in an independent living and then they have an outside, caregiving resource coming in, whether it's a third party or whether it's one of the children, then that has to be listed there separately from the independent living. But on assisted living, that's all listed together. And those communities have the dementia units. It's always, it's all listed there. And that's what the community completes. That's important to keep it as simple as possible. So there are forms for the community. They should be getting a checklist with it, line by line. That's what we provide. Here's what you put on line 1, line 2, line 3, 4. So keep it simple. What's very important for the children that we deal with is to get the documents that are going to be necessary to filing, like a copy of the discharge papers or DD-214 if it's post-Korea, marriage license, okay, if they're married, they have to have a legal marriage. And then there's a form for the community, form for the caregiver. If it's separate, then a form for the doctor, and then the Social Security letter. So those are the things that are needed up front. The second phase is community completing the application, and you could do it online, and it's not that easy to do. We do the application completely, and all we need is signatures.
Yes, it is complicated, and I second that. It is not easy to do, and it's very much a process. So it's nice to know that the pay is $24.30. You add in your Social Security with that, and it's something that you can get if you're doing any type of assisted living memory care. It is something that is providing you with a moderate, a medium, on pricing, good quality care for your family member or yourself, whichever the case may be. And then clearly, if you're aging in place and you're at home with a family member, then that's definitely something that's really going to be helpful as well. So last question, for the process for someone to apply. So you are a designated nonprofit organization, and then you just basically help facilitate. And the VA you work with the VA, so they really absolutely appreciate the work that you do. It probably takes a lot off their plate, do you think?
Yes, it does. And anyone can go to their local county service officer. Every county has a service officer, whether, it's in Florida or North Carolina, South Carolina, and they can go there. And those are typically employees of the state. Okay. They're not an employee of the VA. They represent you before the VA. There's also the other service organizations that you could go to, like the American Legion, the DAV, the FW, and they have typically a service officer in the post, okay, usually a volunteer. They have to get accredited. There are accredited attorneys, and there's accredited organizations like ourselves that we are accredited with the VA. We are online with the VA. We represent the veteran, their spouse, before the VA. Once we send in the paperwork, we upload it directly to the VA, and then we have access of what's going on, on that particular claim with the veteran against spouse or widow. People don't understand that there's this benefit for the widow or the spouse. There's a lot of different ways to do it. Again, you can go online. I don't recommend it because, for example, you'll file what's called a 540 EZ form. Yeah, it's supposed to be easy. Okay, but if you have more than $10,000 or you have a house, then you have to file this other form, which is 18 pages. So it gets more complicated. We see every week, typically it's spouses where they have lost half of their husband's income. And boy, they're struggling. And this benefit is so important for them to be able to live in, a community or have somebody come in and help them.
I think we talked about that a tad, but kind of went over that fairly quickly. So it's not just for the veteran, it can be for the spouse.
That's correct. This is kind of the misinformation out there. And usually the calls that we get are basically, what are the survivor benefits? Once we asked a little bit more, how'd you hear about us? It was from somebody else that we helped. Okay. And the words get around, and it's something that people ask us as a nonprofit, what can we do to help? And we say, spread the word.
Love it.
That is so important because you don't know what you don't know. It is important and so the talk usually comes around to why they got that benefit and they're happy about getting it. That's for sure. You've been there, you've done it,
With the survivor benefit, I just want to clarify that. do they qualify equally as their spouse would have? So their spouse served in the Vietnam War, they completely qualify, their spouse passed away, and now they need assistance of some sort. Do their qualifications, do they have to file the same paperwork as the spouse? Is that basically how that's going to work?
That's correct, is that the paperwork is based on the veteran, whether it's the male or the female. And so that is basically who we're filling out for, is for the veteran, and then the spouse or spousal information there. So obviously the doctor's records are on the spouse, and the doctor records, and also the community. The same thing, if we have a veteran that does have a spouse and they're in their 90s, we're going to go and file for the veteran first, because it's a larger amount of money that would be given versus if it's just a widow. That's what we try to do, is to make sure that we get the most amount of money for that veteran. Now, there are other programs for the veteran besides the aid and attendance that can pay additional monies, but it's for the veteran only. That would be addition to the aid and attendance, and that will vary from location to location across the United States. We'll look up and see if they have this other benefit. It's called the Veterans Directed Care Program, and in that particular area. But that is for the veteran only. The program that we've been talking about, the aid and attendance, is for the veteran and or the spouse.
Okay. And or the spouse. Okay. So I just wanted to clarify that, because I know we've been talking. I feel like we kind of backtracked on that. I just wanted to clarify that, because that's not something I picked up on when we were initially talking. I know that you mentioned it, but just double checking. So when you talk about this other benefit that's just specifically for veteran, and you talk about areas, are you talking about entire states? Like one state may offer it, but the other state does not?
It's more precise than that.
Okay.
For example, in New York State, there's only 2 locations. In Florida, there's 4 locations. It varies from state to state and how many clinics offer this program. And it is a new program. It just went into effect about a year and a half ago. Now, we do not file the claim for that, but we will provide all the information of how to do that.
Okay.
It is only for the veteran. Typically, where we are recommending that particular program is where the veteran has dementia. We're coming back to dementia, and the spouse is trying to take care of that veteran at home for a while, and they need more help, because a veteran that does not have Lewy body or frontal lobal, the younger dementias have Alzheimer's. So if they have Alzheimer's, it's typically they have a longer than normal life expectancy.
Right.
But the caregiver has a shortened life expectancy because of the stress and strain and try to take care of them.
The depression, the anxiety, the physical toll that it takes on the body, 100%.
Because what we see a lot of times is the veteran, if it's a male, he may have a younger spouse. Okay, just the way that, we have here in the United States. That spouse has a devotion to her husband and wants him to stay at home. Can't do it. It comes a time they just can't take care of him, because usually the male is a lot bigger than the female, and trying to even turn them over is a burden. So they need the additional care coming in to help them so they can go to the grocery store and do things that basically they need to do if their children do not live in the area. Otherwise, they're relying on their children to help.
Right. Even the time to just have some social and activities where they can get out of the house and still be themselves a little bit, I think is really super important. So that's really great that you mentioned that. Anybody that's interested in getting more information from you, can you help people outside of the state of Florida? I know that's where you're currently located, Joe. Right.
We handle the whole United States. Let me come back to the VA Directed Program just a little bit. The amount that will be paid in addition to the $24.30 a month for the veteran at home, we have some that are getting $2,000 to $3,900 in addition to the $2,400. Obviously, home care is much more expensive to bring somebody in. I guess the furthest way we helped a lady at our embassy in Vancouver, British Columbia. Her dad was in Washington State. She got reassigned to Singapore and moved him to Malaysia, to a community there. And all we did was change the location.
Oh, wow.
And he was still getting his benefits. So I guess you could say we're international too now.
Definitely. So anyone that's listening, the website where you can find out more information is navf.org. The phone number is 904-394-3901. Well, is there anything else you wanted to chat about before we ended our podcast that you think that would be beneficial for our listeners?
Well, I think the important thing for your listeners to understand is that they need to be dealing with someone that kind of specializes with this. As I mentioned earlier, there's different groups that will help with claims, but they may be doing eyeglasses, hearing aids, and they're just overwhelmed with that. So groups like us and AVF, basically, this is what we do. We just do the aid and attendance benefit. If we don't do it, then basically we know who does it. But we get those questions all the time about, I was in the service and basically every day my feet were covered with, the jet fuel. And now I have problems. And I was told, no, I was declined. Or we have people that told, well, I was making too much money for the aid and attendance. I was told that. Not necessarily true. Because again, coming back to the VA website, they say $18,000, but that's net income after all expenses. We make it simple and as possible for the veteran and the children, because 90% of who we deal with are the children.
Yeah, definitely. Yeah, I definitely believe that. I really appreciate your time today. Thank you so much, Joe, for joining us. Again, like to thank our sponsor, Parish Healthcare. Have a great day, everyone.